The Sinai Medical Foundation Oral History Project is being conducted by the Leonard N. Simons Jewish Community Archives. My name is Robbie Turman, and today's date is November 10th, 2023, and I'm interviewing Dr. Robert Michaels. Dr. Michaels, do you give permission to the Leonard N. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for uses as deemed appropriate by the archives?
I'm proud to do so, thank you.
Thank you. We're going to start with when and where you were born.
So I was born in New York City, and then I lived on Long Island till I was about 9, and then the family moved to Buffalo, and at 18 I went off to Ann Arbor University of Michigan, and then after Michigan I went to Northwestern University Medical School, back to Detroit, to Henry Ford Hospital for nephrology training, and then into the Navy in Philadelphia, back to Detroit, and arrived at Sinai Hospital.
So you had quite a journey.
I did, thank you.
So I want to go back to your childhood. Can you tell me a little bit about what inspired you to become a doctor?
Well, I had a twin brother. His name was William Michaels, and he and I were sort of competing with each other, and we worked really hard in school and college. So in the beginning, my brother decided to be a doctor, and I thought I was going to be an engineer. But when I was looking around and saw engineers were not often independent, they were working for different companies and couldn't sustain an occupation for a long time. So I finally decided to become a doctor because I wanted to have an independent practice and contribute to the communities. So that's what happened.
And can you talk a little bit about your medical school experience?
Well, interesting enough, my twin brother and I went to Northwestern University. It was really a wonderful experience. My main enjoyment was the clinical part of the training. And there I learned to interact with patients and become a good clinician. And then after Northwestern, I was in Chicago for another year, and then came to Henry Ford Hospital.
And you specialize in nephrology?
Yes, I'm a nephrologist.
Can you talk a little bit about how you came to that specialization?
So that's another interesting question. So when I was at Northwestern, the teaching in those days were much different than today. People would project thousands of slides, and nobody could learn in an hour from 1,000 slides. But one day a doctor came and gave a lecture that I could understand. His name was Nathan W. Levine. He was a nephrologist, a Jewish nephrologist who emigrated from South Africa and arrived at Northwestern. And we became friends. I worked in his laboratory for a couple of years. And then when I sort of decided to be a nephrologist at that time, so when I came back to Michigan at Ford Hospital, nephrology there was very early and just in its beginnings of the heyday of nephrology and dialysis. And one day the chief of medicine told me they hired a new nephrologist to lead the program. That was Dr. Levine. So I called him up, and that's how it all started.
And can you talk a little bit about how you came to Sinai?
Well, my twin brother was doing his internship and then gynecology residency at Sinai. And he loved the hospital, he loved the atmosphere, he loved the doctors. He thought the hospital was academic and a teaching institution. And he kept on telling me I should come back to Sinai. And then he introduced me to Nissen Sabin, who was the only nephrologist there at that time. And Nissen called me and wanted me to join the practice, and he waited for me to come out of the Navy. And that started almost 50 years ago. We were partners for 25 years until things changed at Sinai and everybody went in a different direction. But it was a wonderful partnership. He was an exceptional colleague. He was what I would call a doctor's doctor. And I learned a great deal from him, how to be compassionate and kind and be a good clinician.
You mentioned being in the Navy.
Yes.
Were you working as a doctor in the Navy?
So when I was done with training in nephrology, I had signed up for something called the Berry Plan, which allowed me to be excused from being drafted, but I was responsible to serve at least 2 years in the Navy. So I was assigned to go to the Naval Hospital in Philadelphia, and I practiced as a nephrologist there. And I was also assigned to be in charge of the sick officers' quarters. It was a very nice experience. It was at the tail end of the Vietnam War, and I got to meet people who were involved with that. I even had an opportunity of seeing an admiral who was retiring from the Navy, and I asked him what he was doing on June 6th. This was June 6th. He said, I was invading Normandy. So I said, what can I do for you? He needed some extra points for his retirement. He got every point he could get. So we could reach back in history even at that time.
Did the fact that Sinai was a Jewish hospital help in your decision to go there? Or was it a factor at all?
Well, I knew the history of Sinai when I got there, and I knew that it had a very good reputation in the Detroit community. And I felt that a Jewish hospital in a city like Detroit and other cities like Toronto and other places was essential to demonstrate the commitment of the Jewish doctors and Jewish community to the health of the general community. So that became a driving force in how I thought about Sinai in all the years that I participated.
And what year was it that you arrived at Sinai?
I think it was 1972.
And your position at the time?
I was a nephrologist. Dr. Sabin was the chief nephrologist, and I was his colleague.
Can you talk a little bit about the atmosphere when you arrived at Sinai, the culture?
Well, all the doctors were friendly. They immediately included me into the nephrology consulting practice. And Dr. Sabin, Nissen, and I worked to improve the quality of nephrology care and the teaching of nephrology at the hospital. It was very important to everybody that we taught residents and interns. The research aspect of the hospital seemed very important to me because I knew the hospital was a leader in research, surgery, ophthalmology, cardiology. Sinai was on the front pages of papers because they were doing new things, first things, angioplasties, bypass, everything you could think of, everything and new things in ophthalmology. Bob Blau and Beckman and other people put Sinai on the map for what ophthalmology was doing. So I knew it was a great place to practice. It was stimulating. It made people do their best.
What was your favorite part about working at Sinai?
The collegiality. I knew that every doctor that was there was appreciated. Every doctor there was allowed to maximize their abilities, just to rise to improving their practice and their skills. That's what made the hospital a very good hospital.
And was there a least favorite part?
There was always political issues at the hospital, and that came and went, but most things were resolved, and the hospital marched on to bigger and better things.
And can you tell me the different positions you held during your years at Sinai?
That's another good question. So I was just an attending to begin with, and then somewhere along the line I was complaining about something, and somebody said, well, why don't you run for the executive council? And I won a position on that board. Eventually I became treasurer, and eventually I became the last chief of staff of the hospital. And I helped participate in the evolution of the hospital after the so-called merger with the DMC. Included the Jewish Fund and eventually the Sinai Medical Staff Foundation.
The Executive Council, what exactly is that?
Well, there was a monthly meeting at Sinai where people who were elected to represent the medical staff met in the boardroom, and we met with the president of the hospital and other officers of the hospital, and we received economic reports and academic reports, and we discussed things that led to conflict resolution and ultimate improvement in various departments.
And did it play a role when Sinai was being considered to merge with DMC?
So the story went something like that. There came a time where the main board of the hospital became convinced that Sinai wouldn't survive anymore. And the first thing was that they wanted to get a merger partner so the hospital could be sustained. So they did hire consultants, and they went to the DMC, and they went to Ann Arbor, and they went to Providence, and they went to every Henry Ford hospital, and everybody discussed mergers. At one time, there was a merger created with Henry Ford Hospital that fell apart for various reasons. And then the march went forward to look for another merger partner. And ultimately, it was decided that the DMC was going to be a good marriage. And the medical staff thought that DMC was academic. They were interested in the community. They would support Sinai's mission of education, research, and all those things that we stood for. But in the end, that didn't happen. So we wound up with the DMC.
So I want to go back to in the years preceding the sale. How did Sinai change between the time you started and the time of the sale?
Well, over the years, Sinai continued to invest in its infrastructure, remodeling the emergency room, redoing the operating rooms, creating new wings, moving the library, making the library better, hiring people that were interested in basic research. And then economics began to take a hold on the hospital, and they couldn't go forward. So there came a time where the hospital was just doing its best to stay there. And I'm sure if it just stayed there, it wouldn't have worked out, because economics for hospital systems, single hospitals, is not working out in America today. So we see mega mergers. We see now Henry Ford Hospital merging with Ascension, and we see for-profit hospitals in Michigan, which probably was, in retrospect, was not a very good idea. So things changed gradually, mainly because of economic issues. But the basic principle of the hospital stayed for all those years: education, research, quality care, commitment to the Jewish community, commitment to the Detroit community. And I still have patients come to the office that say they were patients there, and they remembered and appreciated everything that was done.
When Sinai opened in the early 1950s, the Jewish community still largely lived in Detroit, but by the end, they largely lived in the suburbs. Do you think that move helped contribute to Sinai closing, or I should say merging?
Well, the population that the hospital was serving in the last years was different demographics than it was when I got there. And ultimately, some of the doctors at the hospital were going to the other suburban hospitals, Beaumont in Providence and whatever. And so some of the practices began to change, and doctors had needs to maintain their own professional desires. So that changed. Doctors changed a little bit, but still many of the doctors stayed there. They wanted to serve the hospital. And at the end, many of the doctors tried to go to Sinai Grace and to Huron Valley Sinai. And I believe there's still a lot of those Sinai doctors at Huron Valley Sinai. At Sinai Grace, there's maybe I was the last one or near the last one that stayed there. So the hope was, the doctors had hoped that the hospital would eventually move to another location. And for several years before the end of Sinai, there was a commitment to work with Henry Ford Hospital to move to West Bloomfield. And that commitment was still in place when the hospital was sold. But the DMC spent a lot of time getting rid of that commitment. So the DMC could have been a partner with Ford and West Bloomfield, but that didn't happen. Sinai should have moved in some part to the suburbs, even if they could maintain a presence in Detroit, but it would have taken millions and millions of dollars, and it just wasn't available for whatever reasons. And I think most doctors at Sinai, if you ask them, they regret the opportunity to see Sinai move to the suburbs. Some of the things did happen. There was the Sinai Cancer Center on Northwestern Highway. That was sold pretty soon to Kermanos. And there was an MRI center on Sinai on Northwestern Highway that was eventually closed and torn down. And then Sinai had bought a lot of medical practices, and there were points of service in the suburbs. And those practices were acquired by the DMC and eventually closed. So the opportunity for Sinai to exist in the suburbs disappeared, except for the name that was preserved at the Huron Valley Sinai and at Sinai Grace.
I want to talk more about the events that led up to Sinai being sold. But before I do that, I want to go back a little bit to your career. You mentioned that there was a lot of innovation and academic research going on. In your practice, is there an achievement you're particularly proud of?
Well, after Dr. Sabin retired as the chief of nephrology at Sinai, I became the chief of nephrology at Sinai. And I did my very best to expand nephrology care at the hospital. Ultimately, Sinai became a partner with Henry Ford Hospital with a dialysis unit at Outer Drive. And that partnership still exists through the DMC. And there was another dialysis unit that was developed on Lasher Road at Civic Center. And there was a sign there that said, Lasher Dialysis Unit, a partner of Sinai Hospital of Greater Detroit. So that was the original name, or one of the earlier names of Sinai Hospital of Greater Detroit. That was the last sign that I ever saw that represented Sinai Hospital of Greater Detroit. So because there was opportunity to care for dialysis patients at Henry Ford Hospital, I worked with Henry Ford for many years, and when I was at Ford at Sinai, I had opportunity of doing many clinical research projects, mostly with medications that became useful for hypertension and kidney disease. So that was something I was proud of. And both Dr. Sabin and I were very proud of our teaching residents. And I still have residents come up to me and say, I was trained at hospital. Thank you very much. I became an ophthalmologist, or I became a nephrologist because of Sinai Hospital. And many of the graduates from the Sinai Hospital surgical programs, eye programs, internal medicine programs became leaders in their professions in many hospitals around the country. Even today, there's an obituary in Ira Kaufman of a Dr. Bricker, who mentioned in his obituary that he was trained at Sinai Hospital. So being trained at Sinai Hospital was an extraordinary experience for many, many doctors.
When did you find out that Sinai was being sold to the DMC?
On the executive committee, there was lots of discussions about what should be done. And ultimately, the main board of the hospital hit on working with the DMC. And they came to this agreement, and they did come to the executive committee to discuss it, but it was basically a decision that was already made. And it looked on paper it was going to be very good. There was a promise to continue education, continue the research at the hospital, continue to maintain the hospital, actually enhance the hospital. And Sinai already had a relationship with the DMC in terms of the Wayne State Medical School. And it looked on paper it was going to be a very good idea. But the DMC economically collapsed. And then Tenet bought the DMC. And then, Vanguard bought the DMC. And then Tenet bought the DMC. And all the dreams basically collapsed. And so here we are today with Sinai Grace and Huron Valley Sinai and Tenet was a for-profit system.
When the sale was being considered, were you hearing from other doctors how they felt about the possible sale? What was the reaction within the hospital?
Doctors wanted the hospital to survive, and everybody, the vision was the Outer Drive Hospital and perhaps the hospitals in the suburbs would all survive and everybody would be happy. And the vision didn't come true, so it was a false vision.
And were you optimistic at all about the sale?
Well, so when I became chief of staff, I was at the final board meeting, the Sinai board meeting, where the deal was done, and all they wanted everybody to say aye. So the hope at that time is that things could work out. As I said, it didn't work out the way everybody expected. What did work out, money was exchanged, what led to the Jewish Fund. So the Jewish Fund, and later on the Sinai Medical Staff Foundation Fund, did what Sinai was supposed to do, contribute to the community. So contribute to the Jewish community, and contribute to the Detroit community. So I know the Jewish Fund, 20% of their money, or sometimes more, goes for issues outside the Jewish community. And even the Sinai Medical Staff Foundation has contributed to many projects in the Jewish community, but outside the Jewish community, mostly for medical-related needs and medical education. So in the end, our mission was fulfilled in a different way. So I suppose that having this money in the Jewish Fund did something that wasn't going to happen without the hospital being closed. So that was the most good that came out of all this business.
Can you talk a little bit about the staff merging with the DMC? How was that going to take place, or how did that take place?
Well, everybody who had staff privileges at Sinai were immediately given privileges in whatever DMC hospitals they wanted to go to, whether it was Sinai Grace or Harper or Huron Valley Sinai. And people just made up their minds what they had to do to preserve their practices. And the doctors who were employed still were employed until a couple of years later the DMC closed all the practices that Sinai had previously bought. So there was potential opportunity, but doctors do what they need to do to continue their profession. So basically the Sinai doctors disappeared from Sinai Grace. They didn't. They still go to Huron Valley Sinai.
At the beginning, do you think a majority of the doctors from Sinai went to DMC, gave it a try?
No.
About what percentage do you think went?
20 to 40% maybe. They might have had privileges, but they did what they needed to do.
Do you have insight into why some of the doctors chose not to go?
Well, referral patterns changed pretty quickly after the hospitals merged. So at Sinai Grace, the referral practices changed pretty quickly. And I didn't go to Huron Valley, so I'm not sure what happened, but I think those were probably a little bit better. And so at Sinai Grace, if it wasn't for my two partners who were Pakistani doctors, we maintained a practice. We actually thrived at Sinai Grace. We grew a very large nephrology practice and were able to sustain the dialysis unit. So from my personal point of view, I did just fine. And then at Sinai Grace, I was on their board for 10 years after the merger. So I did everything I could to enhance everything at Sinai Grace that I could, the Jewish identity, the ideals of education and research, creating an environment of care that was exceptional. It was a hard battle because the dollars were not always available to do what was required.
And can you talk a little bit about the differences and the similarities in culture from Sinai to DMC?
Well, there were different doctors from different backgrounds, so there were cultural differences that changed how everybody got along. Doctors who remained there had to create new referral lines. We were treated well. I don't think we were treated bad, but we had to fend for ourselves from a clinical point of view to succeed. So I succeeded because our group gave good care, and we were involved with Ford Hospital and dialysis units. It worked out fine for my practice, but everybody had a different, as I said before, a different agenda and a different need.
Earlier you mentioned bringing the idea of the Jewish culture and identity with you to DMC. Can you talk a little bit more about that and how you try to bring those ideas?
Well, the DMC was committed to integrating everybody's culture, and they were pretty good about it. There was Dr. Rabbi Perlman was the rabbi at Sinai who came to the DMC, and a sukkah was put up in the fall. When there was holidays, there were appropriate food in the doctor's dining room. There was a kosher kitchen, which the Sinai board insisted they would move the kosher kitchen over there, but that was probably rarely used. the Sinai Chapel was there. And the rabbi was good at, meeting with patients and having them understand the Jewish traditions and the Jewish culture as it related to medical care and Jewish ethics at the hospital. But over time, as the doctors left and the few Jewish patients left, the Jewishness more or less disappeared. And when the rabbi was finally let go against my better judgment, that was the end of it, more or less.
And did you feel like there was any anti-Semitism happening at DMC?
That's a difficult question, because if it was there, it wasn't overt. You couldn't measure it, or you couldn't feel it. So it may have existed with individuals in terms of referral practices. If you talk to people, leadership at the hospital, like when Conrad Mallett was the president of the hospital for 6 or 8 years, he was very supportive of Jewish culture, and I know he came several times to give reports to the Jewish Fund and other things, and I felt comfortable of walking into the executive office and telling what I felt and about different things. And it wasn't expressed. I wouldn't say that it was any overt anti-Semitism. The only thing I would say when the hospitals were merged, there was a meeting at the Zuckerman Auditorium where somebody raised their hand and said something about the Jewish people abandoning Detroit, and I took offense to that. In the end, the Jewish people never abandoned Detroit, as I said before, with the Jewish Fund and with the Sinai Medical Staff Foundation. So what was going on underneath everything, it's hard to get to the bottom of that.
You mentioned that you were in practice for 10 years there after the sale. Was that correct?
So I retired, semi-retired about 10 years ago when I was 73, 7 years ago. So I practiced at Sinai Grace from the merger to when I retired, and our group still goes there, and I was proud to go there, and I was proud to do everything I could as a leader there. In the beginning, I forgot to tell you, I was the co-chief of staff at Sinai Grace for 2 years after the merger. And then I was on the board for 10 years. In those capacities, I did my very best to continue the ideals of Old Sinai Hospital.
So can you tell me a little bit about some of the people who influenced your career? I know you mentioned Dr. Sabin and Dr. Levine. Is there anyone else that was a big influence for you?
So at Sinai, there were many people. There was like Eduardo Phillips and Hugh Beckman and Mel Rubenfire and a whole host of other people. All my colleagues, everybody there worked to get the best out of everybody else. And that's I said that before. That's one of the main things you could see at that hospital. Everybody was going to rise to their best level of care, research, teaching, whatever.
You've mentioned the Sinai Medical Staff Foundation. Can you tell me a little bit about how that was created?
So I was the chief of staff at Sinai. The medical staff had accumulated over years $1.5 million, maybe a little bit more. We had it in a bank account. And then one day I got a call from, it could have been from Johanna or Gaylord Alexander, or Hugh Beckman. Anyhow, I was invited to a meeting at a restaurant, and they said they had been worried about the money that the Education Corporation had, which was the sub-corporation in the hospital that accumulated dollars that physicians contributed from their care to patients for teaching and other purposes. And they were afraid that the DMC was going to get a hold of that money. So they had already hired a lawyer, Bob Carbell, and they formed a tentative foundation. And I was asked if I wanted to be involved, and I said, of course, no problem. So I agreed to transfer the $1.5 million from our fund to their money, and they had maybe $2.5 million or $2 million, something like that. But we started the foundation with about $3.5 million.
And what is the mission of the foundation?
Our mission is education, research, contributing to the community for health care related issues. So some of the things that we've done over the years, we established scholarships at Michigan State, University of Michigan, Wayne called Sinai Medical Staff Scholars. And over the years, we endowed initially $150,000 to each of those scholarship funds, and those funds have grown in the universities to $300,000, $400,000, $500,000, and those universities decide who would benefit from those funds each year. So those funds are done in the name of those doctors named Sinai Medical Staff Scholars. And then we've contributed money for research. One of the most important projects that we've given Eva Feldman at the University of Michigan in the neurological research considerable grants for her investigations, and that has been rewarding. We're now participating at the Federation. We're sometimes co-supporting Federation concerns. So our outreach has gone into the Jewish community, but I think still 20 or 30% of our funds go to Detroit, southeastern Michigan concerns.
And is the board made up completely of Sinai affiliated doctors?
Well, in the beginning, yes, and over time the board has changing, and we were originally an independent foundation, and we had a fund manager and a foundation manager. But we became concerned that the longevity of the foundation, when the original members were not here anymore, what would happen. And after about 5 years of discussion, we moved within the Federation as an independent foundation under the wings of the Jewish Federation. And that has been, under Robert Nystuen, has been a wonderful experience. We've done well financially. So interesting thing, we started with about $3.5 million. We've given around $4.5 million, and we still have about $4.5 million. So we've done very well for the funds, but they're actually contributed by doctors. It was a legacy of the doctors of the hospital. So we thank everybody, all the doctors.
It's a wonderful legacy. And is there anything that we haven't discussed during the interview that you would like to discuss?
No, my career has been enhanced greatly by being associated with Sinai Hospital of Greater Detroit. It has allowed me to do things I thought I would never do. And I'm extremely grateful for that. I'm grateful to my colleagues, everybody. And one last thing, the foundation still tries to remember doctors who have passed away at Sinai. So every time we meet, we try to remember who passed on. Sinai used to do that. They would put a plaque up or something when somebody passed away, and that's a tradition that our foundation will maintain as long as we can find people to remember.
Well, thank you so much for sharing your
you.
story with me here today.
Thank you. Thank you very much. Appreciate the opportunity.